As a federally funded hemophilia treatment center, we're actually a covered entity that receives funding through the Maternal and Child Health Bureau. As a covered entity, we actually have the ability to access a program called the 340B program. The 340B program was enacted by Congress in 1992. This allowed hemophilia treatment centers as a covered entity to access discounted pricing for our patients. Many treatment centers have incorporated pharmacy programs within their services to patients. This program income that is generated for patients through the use of this program are used to enhance services for patients. For example, additional staff may be brought in to cover services for patients. Outreach clinics are held. Dental services, dental clinics are provided to patients, and many other types of educational programs, including camps, including outreach clinics, school visits, and overnight camp programs as well for perhaps specific populations such as women's issues. So all of these services are all part of the comprehensive care that is provided to patients and really is supported by the program income generated by 340B programs.
So for example, we have a psychologist that helps address the mental health issues of our patients and their families. We have an educational specialist who helps our kids thrive in their schooling and helps our young adults apply for college and helps our adults who are having some learning issues possibly in their job.
Many of these resources have been made possible through the revenues that come in through a 340B pharmacy program. The 340B program was enacted by Congress in 1992. This allowed hemophilia treatment centers as a covered entity to access discounted pricing for our patients. Many centers across the country have had these 340B programs or pharmacy for many years in their centers. These pharmacies actually are a big component of the integrated care that treatment centers provide to patients and their families.
Because of the fact that there are several things that HTCs do that are not reimbursed, such as the physical therapy and the social workers and research and other things that I perhaps don't even know about, it is important that we as a community support the 340B program. Not forgetting the fact that all the income that the HTCs get from the 340B programs by law has to stay within our hemophilia community. In any of these capacities, whether it's in running the center, in paying salaries, in taking care of our physical therapy, over social issues, if we don't have that, then there is no funding for that and it would disappear. So this is how, again, we can help ourselves. By supporting our 340B programs, we are supporting the health of our own kids, of ourselves.
We use our factor funds to support the salaries of our physicians, of our nurses, our social workers, and physical therapists. But not only that, we use our revenues to help support the more extended services that our patients and our families need. So we're using our 340B funds to train the future generations of care providers that are going to help the people in the bleeding and clotting disorders community. We have many other services that would not be available for our patients and their families without the support of our 340B program.